Thank you, Manyata, Foxy, and all related with Manyata to give me this opportunity to interact with everyone. To begin with, we'll be sharing some case. This is actually is a presentation of Consumer Protection Act with all its is. So I am not going to deal with the whole Consumer Protection Act, and I'm only taking the relevant case laws or cases which are relevant to obstetrics. Now, this is the first case which I'm talking about, single maternity and medical center versus Master Nishant Verma. Now, in this case, this patient was following with Dr. Singhal right from the antenatal time, right from the beginning. And the antenatal period was uneventful. The patient was admitted in labor, progressed well till second stage. Then during the second stage, the baby had fetal distress. So a forceps delivery was done. Unfortunately, after the delivery of the head, there was shoulder dystocia and the baby delivered with difficulty. Birth weight was around 4.5 kg. And there was permanent damage for the brachial plexus, and there was a brachial plexus injury, which was permanent. So pediatrician and neurologist managed the baby. The surgeries were done in France and USA. Baby still continues to suffer from the disabilities. So with this, this case went to the consumer court, initially with the district commission. The allegations of the patients and relatives were medical negligence and deficiency of service right from the antenatal care up to the neonatal care. So they alleged that everything was deficient right from beginning of the antenatal care to the delivery, and even after delivery, the care which was given to the baby. So they alleged there was incomplete antenatal checkup. Physical considerations like obesity, short stature, and pelvic assessment were never conducted. Blood sugars were not done. Gestational diabetes screening in last trimester was not done. So this is a very important parameter which is done in Manyata also, where we do this 75 gram OGT test. So this is how our guidelines or our Manyata training helps us. Then USG was not interpreted correctly, as there was vast difference in estimated weight and actual weight. Most importantly, not clinically correlated. So these are all the allegations. During delivery, handwritten documentation was challenged by the patients. Use of forceps was wrong decision. Vacuum would have been much safer. They quoted Munro's textbook of operative obstetrics for this. And confronted with serious problems during delivery, cesarean section was not done, as OT was not kept ready, which is a serious deficiency in service. So these were the allegations of the patients after the case went wrong and baby suffered permanent brachial plexus. So in the defense, the doctor said that we are qualified doctors, we have a well-equipped facility, we had done 3 ultrasounds during the pregnancy. There was no complications or adverse finding or finding suggestive of a macrosomic baby through these ultrasounds. Progress in labor was smooth until the second stage, when fetal distress was detected. Hence, decision for forceps delivery to save the baby. After delivery of baby, there was shoulder dystocia. Appropriate maneuvers were used and baby delivered. But unfortunately, baby suffered from brachial plexus injury, which is a known complication which can occur with shoulder dystocia. This was their defense. Medically well established that these events are unpredictable and they occur despite perfect obstetric management. They quoted textbook of Williams, which cited that shoulder dystocia cannot be predicted or prevented, as there were no accurate measures to do so. And contention that vacuum would be safe is not correct. They produced textbook of Dr. D.C. Datta and quoted, forceps outweighs the use of vacuum, as forceps can quickly deliver the baby. So these were the defenses from the doctor side. To important things to note, that is, antenatally, findings were not recorded. Glucose test was not done, which is a routine guideline now to do. There are national guidelines for screening of diabetes. So this should have actually come in the papers. Now, what are the findings of the State Commission? And the State Commission said use of forceps with excessive force and traction caused the injury. There was no proper documentation of Mac Roberts maneuver, as discharge card does not mention it. So here is the importance of documentation. So the stature and physique of this patient was not taken into consideration. Baby was overweight was missed, Hence, cesarean section should have been preferred. And they held that the doctors were negligent, the hospital was negligent, and they awarded a compensation of 17 lakhs. Now, this case was contested in the National Commission. When the doctors, when the case went against the doctors filed a case in the National Commission as an appeal. What were the findings of the National Commission? The National Commission said that we find that the medical history as also the height and weight were not recorded. No record evidence that the test for gestational diabetes was prescribed and conducted in the third trimester, and also whether weight gain, if any, was noted. Gestational diabetes and abnormal weight gain are associated with macrosomia, apart from being independent risk factors for neonatal birth trauma. Now, failure to conduct all the required antenatal tests, not keeping a record of the same, and thus not having for ready reference the important physiological and clinical parameters assumes significance in the present case. Gestational diabetes during her previous pregnancy, and that further she was of short stature and had become obese. All this was not taken into consideration. Now, it is well accepted that ultrasound tests by themselves are not the most accurate method of estimating the birth weight of the fetus. The three methods of identifying a fetus with a weight of over 4 kg are ultrasonographic test and clinical and maternal health status of the pregnant woman, and correlating the information from all these three sources to get a reasonably reliable estimate of the fetal weight. This was what National Commission said. Clearly, as per evidence on record, the correlation was not done. We also have no doubt in our minds that there was a clear nexus between the failure to conduct the required antenatal test and unfortunate repercussions which occurred subsequently. Some of the important things which the National Commission said is forceps delivery and vacuum suction apparatus delivery have their own pros and cons. And under the circumstances, the decision of which procedure to adopt is best left to the professional judgment of the doctor conducting the delivery. What they essentially said here is, in an emergency, there may be various options, and the doctor, in his judgment, can choose one procedure over the other, and he cannot be held negligent because he chose one procedure over the other. Brachial plexus and avulsed head of humerus are unfortunate, but they are common fetal complications of shoulder dystocia and are not related to wrong use of forceps. Shoulder dystocia was not properly handled since one of the most important interventions, namely McRoberts maneuver, was not used, as it is evident from the fact that it was not stated in the discharge certificate or any other documents and was added as an afterthought in the counter affidavit. What they said is the clinical notes which was produced in the courts did not mention about McRoberts maneuver. The discharge card which was handed over to the patient did not mention about McRoberts maneuver. Now, only while filing a reply to the consumer court in the case, they mentioned that McRoberts maneuver was done. So the court did not rely on this. The court said, since your notes does not reveal, your discharge card does not reveal that you have conducted a McRoberts maneuver, it was not done. The findings of National Commission are regarding the deficiency in service alleged by complainant is not having the operation theatre readily available for an emergency surgery. The commission said that after the delivery of the head and after the crowning of the head, there was no time for a cesarean section. The baby had to be quickly delivered, since even a minor delay would be fatal. But the National Commission stayed with the State Commission's order of 17 lakhs just because the antenatal investigations were not done completely, they were not recorded, and since the documentation was not complete. That is all. They agreed that forceps can be used in an emergency. They agreed that shoulder dystocia is a complication which cannot be predicted. They agreed that brachial plexus injury and all these damages can occur. But just because antenatal records were deficient or antenatal investigations were deficient, compensation of 17 lakhs was awarded in this case. So what are the lessons learned? Do not be complacent. Follow guidelines on antenatal management. Manyata is one of the good standards which we should follow antenatally, intranatally, as well as for our audits. Record all relevant minute details in your record. Good record is good defense. Since here the McRoberts maneuver was not recorded, the case went against them. In an emergency, choice of procedure is left to the professional judgment of the doctor. complications are well accepted by the court if it is documented in medical literature. If the medical literature says these complications can occur, and if it has occurred, the court will accept this complication and will not hold that as negligence. Follow guidelines. Any deviation from standard guidelines should have a strong and convincing reason and be updated with the latest developments and guidelines. So this was the first case which I discussed. Now the second case is regarding Dr. Kirti B. Nayak versus Sonal Ben Vyas. This was a case of abruptio placentae. This patient reached the hospital with hemorrhage. She was bleeding profusely. At the first hospital, they were not well equipped, so they transferred the patient to the other hospital. In the other hospital, as soon as they reached, they did a cesarean section because she was bleeding heavily. They delivered a stillbirth child. There was PPH when they did the cesarean section. The patient was not responding to medical management. An obstetric hysterectomy was carried out without the consent of the patient and her husband. Now, this was a young patient, just 24 years, and this was her first pregnancy. And because the uterus was removed, there was an allegation that her maternal previous next or future obstetric carrier is destroyed. So allegation of medical negligence and deficiency of service. The state commission partly allowed the complaint and ordered a compensation of around 2.5 lakhs. The appeal was filed with National Commission, and the National Commission set aside the order. What they said was informed valid consent was taken for cesarean section. The person who did the cesarean section was a qualified obstetrician. Now, clinical decision was correct in view of the circumstances and emergency. The patient was bleeding profusely. If this was not done, she would have lost her life. So, in an emergency, the clinical decision taken by the doctor was correct. They relied upon the Supreme Court decision in the case of Kusum Batra versus Batra Hospital, which states that medical professionals are entitled to get protection as long as they have performed their duties with reasonable skill and competence and in the interest of the patient. So what this case means is, in an emergency, in a life-threatening situation, you can go ahead and do whatever is necessary even without the consent. You need not wait for the consent because it is life-saving. Only thing is you need to have records showing that it was a life-threatening situation. And if you can produce those records, you will not be held negligent to do a case without a consent. Now, in this case, this is a government hospital where this doctor was working. Now, this patient was admitted 2 days earlier. Now, case papers recorded that the patient was critically ill, and yet no sense of urgency was shown in performing cesarean. This was a government hospital. So on the papers, it was written as DIL. That means dangerously ill. That is the meaning of this full form, DIL. And they had written ES. Now, what does this ES mean? Whether it is elective cesarean section or it is an emergency surgery. So this was not clear. So the court took that it was an emergency and patient died within 30 minutes of cesarean section. It was said that on that day, the cesarean would be done at around 10, but it was delayed and it was conducted at 11:30. So there was a delay in conducting the cesarean section. So what they said is, since you have written DIL on the paper and you have written ES, which could mean emergency surgery, there is delay in managing a critical patient, which is negligence as per se. And even though this was a government hospital, a compensation was awarded against the hospital and the doctor. So there are nice guidelines which classify the urgency of cesarean section. The urgency of cesarean section should be documented using the following standardized scheme. So they have divided into 4 classes. Class 1 is immediate threat to the life of the woman or fetus. Class 2 is maternal fetal compromise, which is not immediately life-threatening, but needs early delivery. No maternal or fetal compromise, but needs early delivery. And delivery time to suit woman or staff. That means a elective cesarean section or a cesarean section on demand. So these are the 4 classes in which need of cesarean section is classified as per the time decision of cesarean section and delivery time. So according to this, decision to delivery interval for unplanned cesarean section in case of emergency, category 1, when there is a life-threatening situation, it should be 30 minutes. As soon as you have said or you have taken a consent for cesarean section, the cesarean section should be done within 30 minutes. And in category 2, where there is no urgency, but early delivery is indicated, 30 to 75 minutes for category 2 of cesarean sections. So these are the intervals time intervals which are acceptable as per the guidelines given there. So these are the 2 or 3 cases, medical legal cases, which I wanted to discuss, which are very relevant to our guidelines or Manyata protocols. Now, as far as NABH is concerned, NABH gives us structural protocols or documentation protocols. So you saw in this case, since the documentation was deficient, there was negligence was established. So NABH also sets some protocols in documentation, preventive maintenance of your equipment, management of medication, how your consents should be. So all this will help in improving the quality of your service and probably prevent medical legal litigation against us. That is what I wanted to say. Thank you. Thank you so much.